So my tip for the day to help stay safe is that if you have any non-emergent ailment, whether that be a appointment for an annual exam that was scheduled, or anything like that, please just stay home. Those things can be done after, things calm down and this pandemic is at rest. This also goes for the hospital, for people that are coming to the emergency room for, muscle aches and pains and things of that nature that can be easily managed at home. Utilize hospitals and clinics for things that emergently need to be handled. And we're all smart. We know what those things are. Things that cannot wait, that are significantly going to impact your health in the immediate. Utilize our resources for those things, and some of the things that you can stay home for. Please do so. But the bigger thing is that I want to talk to you guys about is that one of the problems that I see that's going to happen is that people that do have issues that need to be addressed, getting labs for those things like imaging, like ultrasounds, x-rays, it's going to be difficult during this time. So as providers, we have to realize the times and realize what's going on and circumvent that setback. So at this juncture, we will we have to realize that, like for instance, I'll give you an example, like have a patient that has postmenopausal bleeding. All right, so usually with postmenopausal bleeding, you get the history, and optimally you would get an ultrasound to see if the lining of the uterus is thick. The lining of the uterus is very thin, and the patient doesn't have any other medical issues, then there's really nothing that you need to do. If the lining of the uterus is thick, then at that point you need to get a biopsy. Well, for me, I'm circumventing that. I understand that getting an ultrasound is not going to be very likely for a patient, so I'm getting past that step and doing endometrial biopsies now for patients that are having postmenopausal bleeding, because for the most part, they'll be benign. But for the rarity that a patient has endometrial cancer, we can't wait for 3-4 months until this has passed to get an ultrasound to make a determination if I need to get a biopsy. That's an example. But as patients realize that, sometimes doctors are not thinking about that. They're still ordering labs like they're going to happen, and not really thinking that once you leave the office, have to now call and schedule these things and not going to get them. So be cognizant of that, and providers also be cognizant of that, is that if there's a lab that you need and you're ordering it and you're expecting the patient to go and get that lab, it's likely not going to happen. So you're going to have to be a little bit more proactive. We're going to have to think a little bit outside of the box. Some of this stuff is definitely not standard of care and conventional, but with these times we have to adjust. And so with that being said, I know I'm adjusting, and I'm hoping all other physicians adjust, and patients and everybody else out there. Like I told you, I try to educate you guys. If your doctor's not adjusting, you got to adjust for him or her. So, ask about labs, or if this happens and I can't get this lab, then what does that mean? Make your doctor think sometime. So I just say that to make you think about the times that we're in and how to continue to be safe out here. Like I said, this isn't a monologue. This is just me dropping a little bit of knowledge from what I'm experiencing out here, from everything that's going on. So use it as you may. But I pray that everybody continues to keep safe. I'm gonna keep doing these in mask because I would, everybody should be encouraging just safety, and all efforts and all hands on deck should be put forth so that this thing can stop spreading and we can go back and start living our normal lives. But again, I've changed my stance on it because I've been more educated. And so everybody else needs to change their stance too. Like, this is not, a simple flu thing. This is not a government scare tactic. This is not the things that we thought it were months ago. This is real. People are dying. The alarm is real. We have to do our part. Everybody do your part. I know it's inconveniencing, but this is temporary. This too shall pass. So God bless you all. Continue to be safe. Talk to you later.